If you are going to run a campaign or any health promotion initiative that has kind of a lot of chops or it's like big enough, you're probably going to need some partnerships. You might need certain stakeholders to be invested in your outcomes, and you might have to work through some gatekeepers as well. So let me just explain these terms and give you some examples of what that might look like. Okay, so partnerships, these occur in business, and in business, just like in health promotion, it's like when two or more parties come together to ideally get towards a common goal, and they kind of both put in resources, time and money, and they kind of share the outcomes as well. Okay, so as it says here, formal arrangement by two or more organizations to develop or manage or evaluate a program and share the results. Okay, so it's a relationship. And partnerships are great because you have more resources, more investment, more reach probably as well. But also one of the issues with partnerships is then you might have competing interests, right? You both might not think that you need to get it done in a particular way, and you might get into some trouble there. So picking appropriate partnerships and ones that are aligned with kind of your companies or organizations' ethics is pretty important to getting a successful campaign out. Okay. So an example of a partnership is the Ascend partnership in Alberta, and this is a provincial collaboration that specifically looks at Albertans with digestive diseases. And the reason I picked this one because it's a newer one, but also I wanted to highlight just how many different types of organizations are involved in this, and that they jointly invested money into the partnership. Okay. So what do? They kind of focus on three main strategies as far as focusing on digestive diseases. So they develop and evaluate nutrition-based therapies. That's one strategy. They also focus on the patient experience, specifically on personalized medicine. And then there is a knowledge translation aspect of this program as well. Okay, but the main highlight here is we have different organizations working together on a particular strategy, and then using, this doesn't really speak to tactics, but using different tactics within that strategy to accomplish a specific goal. Okay, an example of a corporate oriented partnership is that between Coca-Cola and Participaction. So Participaction's gotten into some trouble, backlash about this partnership because it kind of seems that their ethics might be a little bit different. You know, Participaction is all about increasing physical activity in Canadians, and Coca-Cola, well, its main goal is to make money. You know, it's a corporation, a very large corporation. However, they got money. They got lots of money. Participation has a name, and they also have outreach, and they also have government investment. However, Coca-Cola has deep frickin' pockets. So that's sometimes why people do in health promotion use these particular partnerships, because again, although our ethics might not be always the same or aligned, it can maybe help us have more reach. But I think you have to be really careful with these because there is a trust factor that can get in there as well. So we'll talk about building trust in one of the next units, but just wanted to highlight this one as well. Okay, so partnerships, two or more organizations coming together, we're going to invest time, we're going to invest money, and let's do this particular strategy. Okay, stakeholders may or may not invest time and money. They're just kind of interested in the results. Okay, so people or groups with some of the same interests as ours. Okay, they want the same particular outcome, and we might tap into them for just support, for just saying, hey, can you recommend our program? Or at the very least, can you not do anything to hurt our program? Okay, so we can use them as potential partners. They can fund us, supply us, sponsor. They can help us get seen in different areas, but they're people that we can tap into that also have an interest in what we're trying to do. So I'll give you some examples. So when it comes to child oral health, okay, so good teeth in children, there are different stakeholders that are all invested in having good oral health. So for instance, dental hygienists, the dental association, these might endorse a particular child health campaign. And Colgate is also a stakeholder in child oral health because, they can make money if children are, doing best practices. And for a particular campaign, these three different organizations might contribute different aspects to that particular campaign, but they're not like sharing the global message and the global like strategy development together. Okay, but we can like tap into them, be like, hey, can you give me this? Hey, can I get this from you? Hey, can you promote my program? They're people we can tap to help us, deliver a particular message or initiative. Okay, so here's other example of stakeholders. If we think of reducing sugar consumption, well, the obvious people that are interested in this are dentists, but doctors are also interested in that as well. So are dietitians. People in obesity are also interested in that. Diabetes professionals, and perhaps those that sell like fresh fruits and vegetables. Those might also be interested in reducing sugar consumption, all for different kind of reasons, right? Dentists, dental hygienists, they're about teeth health. Doctors might focus a little bit more on chronic disease prevention. Dietitians, they're just like more about, good overall nutrition. Obesity and weight professionals, they're more interested in reducing weight in the population or healthier weights, promoting healthier weights in the population. Diabetes professionals are obviously interested in reducing diabetes. And whole food sellers, they just want to make money off of their whole foods, okay? But again, can I tap them? Can I be like, hey, I have this program. Can I get some money? Can I put my ads in your place? Can I like get you to give out brochures to your patients, right? These are people that I can tap to get my whatever it is across, okay? So here's another example. We talked about Active Canada 2020 in an earlier unit, and remember that this doesn't have like a government run lead. Okay, it's just different stakeholders in physical activity that came together and are like, let's do something about it. Okay, and because they argued that the approach to physical activity has been fragmented and lack coordination, so they're like, let's just do it ourselves. Right? They're like, we're interested in this. Let's put a team together of people that are interested in this, and let's like focus on improving the physical activity of Canadians. Okay, so it does involve policymakers, although it doesn't have a formal policy like lead. Employers, educational institutes, community organizations, people in general, caregivers, these are all potential stakeholders that want people to be more active for different reasons. So for instance, employers want people to be active so they take less sick days because they're healthier, so they ultimately make more money and are like, more productive at work. Okay. Educational institutions care about people being active because, again, they could be healthier, more attentive in school, whatever else. So they may want the same thing, but for different reasons. So that's something to keep in mind when it comes to stakeholders. Another type of person that's important to recognize here, and the reason that I have a bouncer as like the visual of this, is a gatekeeper. This is a person you need to go through. So for instance, if you want to run gym-based initiatives, well, you got to contact the head of that gym, right? You're not just going to run in and do that. There are people that like hold the keys, that you have to work through them in order to get into that particular community. Sometimes gatekeepers are like opinion leaders or like big people with like a lot of pull in a particular community. Like if you get someone, like let's say a particular political figure on board, well, they have a bunch of people that'll do anything that they say. And we can think of current examples of this. So if I go through that gatekeeper, I have a bigger reach within that particular community. Okay, the example I gave before is if you want to go into schools, you got to go through the principal. You got to go through or the dean or the chairs or whatever else. There's like the decision makers. These are people that ultimately decide, can you do this intervention in this particular area? Okay, so that gives you an overview of some of the people that we might want to work with as we deliver our health promotion campaign.